What has been Vermont's experience with the most recent opioid addiction?
We have seen the opioid crisis as a public health and issue. And the crossover that we see with child welfare is, when we looked at it most recently, up to 80% of the reports of child abuse and neglect, substance misuse has been an issue.
Mm-hmm.
And we have seen the age of the kids who come into the child welfare system becoming younger, under the age of 2, which is sort of an alarming rate. That also puts pressure on our system in terms of foster parents, because it requires different experience, different expectations of foster parents. And secondly, in terms of if the goal is to reunite families, if they can be, how do you reach and talk with and improve the parenting of these kids' parents?
What are some programs in Vermont to address this issue?
We contract with a private nonprofit, the Lund Family Center, which has a residential program where, in fact, the mom and their infant can be together, and where there is treatment and education and parent training for the parent, and there's care for the infant. So that's been one of the things that's been really important. Clearly, in terms of opiate treatment, pregnant parenting and mothers rise to the top of the list. But what that means is that we need to have access to treatment. And we need to also, what we've learned is that early identification is really what's very important. And so one of the other very effective programs that we have in Vermont was not at all started by the state. It was actually an outgrowth of what is now known as the University of Vermont Medical Center, and their intervention with pregnant or about to give birth moms who had opiate in their system. And that has developed into a program called CHARM, which is Children and Recovering Moms, and it is an interdisciplinary program. It talks about, it really fosters collaboration and communication between all of the partners, between DCF, Department of Children and Families, between the physician or the hospital, and between service providers, Lund Family Center, as I just talked about, or our community mental health center, which also provides alcohol and drug abuse, and our visiting nurse association. So it's facilitated by a community organization called Kids Safe Vermont, and where in the beginning all of the barriers around communication or different views of what is abuse, and if there is opiates in a system, in a person's system, is that automatically a report? Is that automatically child abuse and neglect? And they went through all of these conversations, trying to have a shared vision and a protocol in terms of how to treat and how to respond, and their results in terms of infants staying out of custody or being able to remain with their moms, and healthier newborns have been really quite effective in order to address the intersection between substance use, in particular opiates, but and the child welfare system. We have ensured that there is a substance abuse screener in every single one of our child protection family service agencies. So we ask the question, and we know how, because if you don't ask the question, you're not going to know, and you're not going to be able to refer and get people to treatment immediately, because that's another piece that is important for success. And so, And what that substance abuse screener can do is, one, help staff and screen in terms of then we can refer families to the appropriate treatment, and the screener might be able to facilitate some of that quicker response. Vermont is like many other states. We don't have an unlimited supply of providers, and so sometimes that is one of the challenges.
What do you see as the legislature's role in this?
Legislature's role, number one, is to shine a light and to keep that light shining brightly, because in my mind, the protection of children, there is no more important role in state government than to protect children and to ensure that children grow up healthy. It sounds trite. Children are our future. If we want our economy to grow, children need to have a healthy start. If we want someone to take care of us when we're older, we need kids. I mean, all of those things. So it's to keep the light shining. It is to remove any legislative or policy barriers between, in communication between various branches of state government or between agencies, and whether it's policy barriers or whether it's funding barriers, to try to look at that, to set the expectation that this is a community problem, that it takes multiple players, and we all need to communicate, and to set that as an expectation, and to facilitate communication wherever is necessary, and of course to provide the funding that is necessary so that people have access to the services and supports that they need.